Hi Jim, my name's Megan. I'm just going to go over some lab values that are going to be part of the liver panel that your doctor ordered for you. Have you ever had a liver panel done before? No? Alright, well, the liver is very important for filtering your blood and processing the nutrients in your body, so that's why we're doing these lab values. So I'm going to go over them pretty fast, so if you have any questions while I'm talking, just let me know and I can stop and answer any of your questions. Alright, so the first lab value is AST. The normal range for that is 10 to 40 units per liter. So this is tested to check for inflammation in your body because when cells die or are damaged, they release AST in order to respond to the damage with inflammation. So AST levels are affected by alcohol intake and pregnancy. Some signs and symptoms of increased levels of AST include nausea, jaundice, and weakness. And then with decreased levels of AST, some signs and symptoms include not digesting proteins correctly, muscle weakness, and fatigue. And two reasons why we could be testing for this would be cirrhosis or hepatitis. The next one up on the list is ALT, which the normal range for that is also 10 to 40 units per liter. ALT is tested to check for many different diseases of the liver. ALT levels are affected by heparin usage and obesity, and then some signs and symptoms of increased levels of ALT include loss of appetite, jaundice, and dark urine. And then some signs and symptoms with decreased levels would be fatigue, weakness, and nutritional deficiencies. And then two reasons why we could be testing for this include liver disease and hepatitis. The next one on the list for you is alkaline phosphatase, or ALP. The normal range for that, we want it less than 142 units per liter. ALP is tested to see if your biliary tract is functioning correctly, which is the biliary ducts, without anything blocking it, because blockages can increase the level of ALP. ALP levels are also affected by anticoagulants and fatty meals. Some signs and symptoms of increased ALP include bone pain, jaundice, and itchy skin. And then decreased ALP symptoms include numbness, tingling, and a zinc deficiency. And then two reasons why we could be testing for that include hepatitis and if you have a history of chronic alcohol ingestion, because alcohol damages your liver. The next lab values are direct and total bilirubin. So direct bilirubin, the normal range, we want it less than 0.3 milligrams per deciliter. And then total bilirubin, we want the normal range is between 0.3 to 1 milligram per deciliter. So both direct and total bilirubin are tested to evaluate the liver function in relation to the breakdown of red blood cells and hemoglobin, because the liver's job is to filter the blood and break down what we don't need anymore. So the direct bilirubin levels are affected by contrast dye usage and anorexia, which is just malnutrition. 3 signs of increased direct bilirubin levels include dark urine, jaundice, and pale stools. And there are actually no signs of decreased direct bilirubin. It's asymptomatic. It's not clinically significant. 2 reasons why we could be testing for your direct bilirubin is if you have any type of jaundice, which is yellowing of the skin, and if there's any suspicion of pancreatic cancer. 2 factors that impact your total bilirubin results are direct exposure to sunlight and high amounts of foods like carrots. 3 signs of increased total bilirubin levels are itchy skin, fatigue, and jaundice. And then again, for decreased total bilirubin levels, it's not significant when the levels are decreased and there are no signs to look out for. The next one is albumin. The normal range is 3.5 to 5 grams per deciliter. And we test your albumin to find out your nutritional status, which is important for your liver function. And then 2 factors that affect albumin results are pregnancy and IV overhydration. 3 signs of increased albumin levels are thirst, dry mouth, and other signs of dehydration, which could be like dry skin. And then 3 signs of decreased albumin levels are fatigue, edema, and poor wound healing. And 2 reasons why we could be testing for this include liver disease and chronic inflammation. And then the last lab value that we're going to be testing for is your total protein. The normal range we're looking for on that is 6 to 7.8 grams per deciliter. And then total protein is tested to figure out the nutritional status of the body, because this can indicate damage to the liver. 2 factors that affect total protein results are a diet consisting of low protein and certain medications. And then 3 signs and symptoms of increased total protein are joint stiffness, dehydration, and fatigue. And then 3 signs of decreased total protein would be brittle nails, edema, and muscle wasting. 2 reasons why total protein is ordered includes liver disease and cirrhosis. All right, so that's all of the lab values for you. Did you have any questions for me at all? No? All right. Well, once you get your results, your doctor will go over with them if there's anything abnormal, okay?